Malo lalai ai Tonga ko tapeng mo mea mai pa malo la maria ho eki ko e fiafi a tawana kia ni Amerikani ai ko a ho valueni o a kosi o i wana wataha a ko e fiafini o pia e mau polo klama makehe e fiafini a te mau watu hangaton peia mi he live mi he toke tāmi Tonga o whikau aki pia mo e vaccine going a component of vaccine o fu mahinga program e fefini ke ma wata ko nga wa nga ilao o ku fa ke lava ke ilhe kakai ki me ko o hoko ki vaccine ka ki mo ke tau hoko te program ko ni ko kole ke Dr. Ray ke ne hanga fai ma tau lotu ki mo ke tau kamata. Dr. Ray, welcome to our special program tonight, and if you don't mind, say a prayer before we get started.
Yeah. Our Heavenly Father, thank you so much for keeping us protected from the deadly virus diseases. You gave us the power and authority by your name and the Holy Spirit. We pray for you to give us the wisdom today to understand the vaccine and how it's working in our body and what is the recommendation and how we respond. In Jesus' name, be with us. Give us the wisdom and the power with your Holy Spirit. We pray for Tupo, Hello, soul to be rest in peace and pray for us. In Jesus' name, listen to our prayer forever and ever. Amen.
Amen. Hello. Hey, that's okay. We'll have you now. Kapobe, yeah, kapobe the cat. Dr. Matabe. Kapobe. Yes, yes. Come in when you go. Okay, bye. Okay, Dr. Ray. That was uh, beautiful. We'll never forget Master Helu. And every time we have a program, I would love to play that until her funeral on Friday. So we will be attending the funeral on Friday in Texas. So, but let's come back to why are we here tonight, Dr. Ray? Can you explain a little bit while I try to pull up the and I think it's so important for people to listening tonight, and we'll try to translate it as much as we can. So, and Brenda will be joining us soon here as soon as she gets home. Go ahead, Dr.
Oh,
Ray.
actually, today one of the very important discussion on our Tonga World News show. Um, the government want to do a law. This by this law, everyone must be vaccinated. And they said everyone can reply in the to the parliament. But for me, for everyone who wants to write to talk about the vaccine law, we need to understand what is the vaccine and how it's working our body. You can't do like in blind to make people blind to road their view because the end what's going on. The World Health Organization, as a health practitioner, we need to explain to the public what is the vaccine, and then the public they have the right for the understanding and before everything, I want to just mention one thing. The vaccine is made to prevent the symptoms. Okay, so someone gets sick of COVID-19 or Delta, the new type, or Lambda or any type. Here, the vaccine will not make it as a deadly symptoms. Just the symptoms will be very okay. So the vaccine to prevent the symptoms. It doesn't matter if you have the vaccine, you will not get sick. No, you still have a good chance to get sick, but the symptoms will be less. Okay, the symptoms to be less depends about the vaccine you take. 80%, 90%, 70%, but there is a variety of vaccines. I'm not here to say take the vaccine or not take the vaccine. I'm here to explain what is the vaccine. We have here in Tonga AstraZeneca, and I have a lot of people. They ask me what is AstraZeneca because when they ask, the doctor said we don't know the component of AstraZeneca, and for me to respond with not a clear answer, that's make the public will be a lot of argument. When the doctor responds with clear answer, make everything is clear to the public. Okay, so I would like to start with the show I prepared. Before we start, I want you to translate in Tonga what I've been saying.
Okay. Uh, go ahead. Po e whiawhini o ku iai ai uhinga o ku mau wata programa e whiawhini ko e tokanga e toke tā ke tau ilo i ai mahu inga o e vaccine ko ni ko vaccine o kwa ke uhinga ia ko ha mea ke nehanga o whaito o ai mahaki but it's a preventive o nehanga pe o mai ke whaka ehi ki tau tolu ke mahaki ka ku mau inga o pito e whiawhini ke tau uh, just give me a minute, Dr. Ray, I'm sorry. Ke tau, wait a minute. I'm sorry. Let me try to.
Yeah, so today we'll explain
Yeah,
how
go
is
ahead,
the
Dr. Ray,
vaccine.
while I'm trying to make
I
sure I
understand.
get, yeah.
So today we'll talk about the vaccine in general, and then we start talk about the vaccine in our situation, COVID. Again, the vaccine to prevent the symptoms. It's not yes to protect you from deadly symptoms, but again to prevent. So people took the vaccine, they should continue washing hands, wearing masks, gloves, keep distance. Okay, so you not get sick. But if you get sick, now the symptoms will be less. How this works? We'll go through one by one. Today, just I will speak about AstraZeneca, and then Tuesday we talk about other type of vaccine. Um, for me, when I speak or talk, that will be for medical background and reference. So if you can play now the slideshow, the PowerPoint.
Do you want to start with the PowerPoint or you want to start with the law?
Oh yeah, start with the law and read it in Tonga. Like you can
Yes.
give
Yeah.
subtitle.
Te tau kamata ki pe o ki ai ala o ku whanga. Is this one they just try to create this law or this law is been already there and they try to amend it?
Yeah.
Okay,
People
where
need
allow
to reply to the
whanga?
parliament.
Go ahead, Dr. Ray.
The people need to reply to the parliament about what they think about this law. That's why we will explain it.
Okay, ko allow ko ni o pehe he toke tā o ku whema ai kakai ke mo tari ki wharerea o whekau aki mo lau ko ni o nauhanga o whanganga ke nau whotu whekau aki mo vaccine, eh? So, ka pate mo siya mai peke he mau screen. It may be a little bit, I'm gonna try to see if I can make it bigger, but let me see if I can read it from my phone. But at the same time, if you guys can see it on the screen, kapate mo lava siya mic his screen. Uh, Kau whenga atu ke uhanga o riri watu ai lao koe ni. Okay, Dr. Ray, can you explain a little bit about this law while I'm trying to see if I can help? And this is
Oh,
particularly for the vaccine, is that right?
yes, for every if this law passed in the parliament, that means everyone in Tonga must have the vaccine.
Okay, ko lao koe ni upehe toke tā ka pao e pāse lao koe ni ko pao ke whiema o e toko taha ko tope I tonga ke nau vaccine. Go ahead,
In the
Dr. Ray.
meantime, they want the public to be reply in writing to the parliament about this type of law. What do you think about?
Okay, e taim tatau pe whiema o e nau tolu ai publiki pa koe kakai ke nau tohi mai ki he lao koe ni ka pao ke hanau ngai whihu I ki ai. Te,
For me, to let the public respond to this law, the public need to understand what is uh,
ko,
everything about the vaccine.
yes,
Then they can get the response. Otherwise, we'll have a lot of argument and fight.
ko ia, ko e pehe e toke tā ki mua ke mou tohi koe ni o tari ki he lao koe ni, o ku whiema uia ke mou mahi noi e mou tolu ai vaccine, ko hae ni ngahi component ko ni o vaccine ko hinga ta programa ko he whawhini ke tau ilo ke tau wako ke tau ilo ke ngai mea ko ni o ku ngahi aki ko ai vaccine.
Okay. Now we can go to the phone. So we'll start speaking.
Yeah, and before we go, I'll just gonna announce kapape ke ha mo ngai whehu i ke lao ko ni pe mo whetu taki mai pe ke mau DWN ke te au pe ko Brenda e lava ke ma whetu taki Dr. Ray ke ne hanga o te mai ha tari ka motol ka ko lao ko ni o ku whaanga ko ni o whema au ai public ia tatu whita moto i tonga ke mo tohi o tari ki he lao ko ni ka pau ia ngai whehu i pe mo whetu taki mai ka mautol ke mau hanga o atu o whenga ke mau mai ngahi tari ko ia ke mua ke mo respond, malo. Dr. Ray, so next one we're going to be going to the PowerPoint.
Yes, please.
Okay.
And I want everyone to stay with us because today it will be a lot of information and it's very important to understand.
Yes. Pe mo kataki pe o mo share te programa ko ni he fu mau inga au pito e whawhini ke tau wako ke tau ilo ki he mea koe ni oku ngahi ake vaccine. Okay.
Yes.
Uh,
And I believe today will be the first time in Tonga someone explain what is the vaccine and what the component of the vaccine.
Ko ia. Ko fufa dai mena ma wata ai me gani pa live hanga tot mai na Dr. Ray Ebrahim pe tonga ke na hanga fa matala ai mai ai component ko to ko ni o vaccine pe ke te au fu ma winga au pito ka pa pe mo ila pa hinga kwa no fe hui ke vaccine pa mo kamata share te da programa ke na usio mai ke ai. Go ahead, Dr. Ray.
So we go to the second slide.
Sure.
Yeah. Okay. Here we are. If you look to this virus, that's how to look the COVID or SARS-CoV. We have here the virus and then we have the crown. And under the crown, we have here the S spike protein. So the crowns here, they make something we call it S spike protein. The S spike protein here, when the virus goes to anyone's body, start to have this type of protein. Our immune system is work with code. So someone have the code of vaccine, of chicken box, to piece it with people, even with 1 million people have chicken box already. When the virus go into to their body, the immune system have the code, so the person will not get sick of the chicken box or measles, whatever the vaccine he took. So our problem with COVID-19 here was the S spike protein. That's from day one. When the in Wuhan, the doctor will start to see different type of protein pneumonia caused by different type of protein, and the investigation start to be done at this time, and they name it as COVID-19. So the second slide, the third one, yeah, here we are. I have here three sources here. In general, some vaccines they go inside. If you look to the one on the left hand, some vaccine here dealing with the virus straight away during the DNA of the virus. So this type of vaccine use the virus to put it in our body, and then our body will get the code of the S spike protein, and then we start to build the code. So when someone get the virus, the body The immune system already have the code and start to do the B cells and T cells to protect the people. The second one here, this second type of vaccine, which is the vaccine here, just dealing with some part of the virus. So AstraZeneca actually dealing on the middle one, just the S5. Okay, some vaccine they just like deal with some symptoms to prevent the disease. The third one, this about genetic material. Some vaccine just do with some genes material here. Between the three of them, we start to build up how the vaccine will go. Because the first wave, second wave, third wave, people get sick of COVID, then people thought the immune system, they already get the code, so will not sick again, which is wrong. I have a lot of patients in Egypt. They get sick from second wave, first wave, second wave, third wave, which is showing here that our immune system, they don't have the ability to get the code of the virus. See how it's dangerous? That's why when the people took the vaccine, it's mean it's to prevent the symptoms because we're dealing with trigger here. Okay,
Mm.
we're not dealing with the whole thing. We're just dealing with the trigger, the symptoms. Okay,
Okay.
you get the idea now? You need
Yes,
to
good
translate
idea.
to in Tongan language?
Yes, Dr. Ray, before I explain this in Tongan, let me understand this. So we have to have this either one of them in order for them to create a vaccine. Is that, and where are we at with the COVID-19? Is it number three or number one?
No, we actually okay. We number two. We deal with the
Well,
bacteria.
number two. Okay,
Deal with the
so
S5. We deal with the S5.
okay, the S spike. Okay. So when we have number two, that's when they need to create a vaccine. Is that right?
No. Okay.
Okay.
The idea of vaccine come in three categories or three levels. Some vaccine deal with the whole virus like measles, chickenpox. Okay.
Okay.
So here you take the virus very weak or dead virus, inject it to your body. So the body get the code of the virus. So when the virus enters your body, they already have this code, this memory to attack the virus so you will not get sick. This not what we're talking about. The second level category of vaccine, they dealing with the trigger, what the virus target in your body, and they deal with this target. This called S spike protein or just dealing with some what the virus doing. So maybe the outline of the virus to reduce the third level of the vaccine when we're dealing as genetic material.
Okay.
From where we get this genetic material, okay? Like the DNA,
Okay.
okay?
Okay. So what is saying the vaccine that they are creating now is only for the symptom, is that right?
Yes, to
Okay.
prevent the
The
symptoms.
okay, aya ko meko pe he to ta ko vaccine ko no ku fa ko he tai ni mi na hinga pe ya ke prevent ke hanga ke fa ke tau tolu me he symptom me ngai fa ilonga ko ni COVID. That's what it's ok mau inga pita ke tau ilo I ai fa ke ko ni ko symptom ko symptom ko ngai fa ilonga ko ni o poke ko ni COVID. Ko hinga ko ni a vaccine ko ni ok fa ko he tai ni mi. Go ahead, Dr. Ray.
Okay, so when we go to uh, the
The
next
next
slide,
slide. Okay.
yes.
You see it on the screen? I have the DNA and RNA.
Yeah, but I'm still seeing on the screen the second one. So if you already finished, okay, I will explain from here because it's not changing on me. You see what is in your screen?
What I'm seeing on my screen,
Yeah.
the genetic approach, is that right?
Yes. Okay. So here we have DNA and we have the mRNA.
Right.
What is the difference to understand how this works?
Okay.
The RNA, the DNA, to understand the DNA is so complicated. But the RNA, this the one feed the DNA. So nowadays, the new technology now of medicine, how to fix all the genes through the RNA. Okay, that's this since like maybe 2007 or 2006. How we and study how we fix the DNA through the RNA. But here we have M before the RNA. M, that's the messenger between the RNA and the DNA. When we have the virus, when we talk about the cell level of the protein, the material, how come our immune system respond straight away from the messenger RNA, from the S spike protein, from the virus in our body to make the DNA start to build up the immune system against this type of the protein from the virus. So here, the messenger, it's very important. Why it's very important? Because once the virus go in our body, we have the messenger from the RNA telling the DNA, hey, wakey, wakey, I have here the code I have. And here the immune system starts to react. This in a very simple way.
Dr. Ray, can you adjust your microphone because it's kind of static?
Yep. Right. You want me to explain again?
Yeah, if you can adjust your microphone before you explain that again. So
Okay. And we have DNA and we have
the RNA,
mRNA. Yeah.
right?
M that's the messenger. So
Okay,
for
M is for
messenger,
messenger. Okay,
yeah, messenger RNA. Okay.
okay,
The messenger here, the messenger RNA is in a specific this to tell the DNA there's a protein coming. If this protein matches the DNA, it's okay. If it's not, here the immune system starts to attack. But we need the messenger RNA to have the code. So if we have the code of from the S spike protein from the virus going through um, vaccine or any medication to give us to give the DNA message that this protein is here, so the DNA start to build the immune, like the immune system starts now to have the B cells and the T cells. Remember, our immune system work with code. If I don't have the code of the disease, my immune system will tired to attack this disease. So we need to have the code of any disease. And that's the idea of the vaccine. Okay. So
okay,
the vaccine here try to give us the mRNA, the messenger RNA to our DNA. So our DNA to respond from the S spike protein created by the virus in our body. Okay? Remember that COVID, the S spike protein, all the vaccine we deal with to prevent the symptoms.
Right.
Because people nowadays they thought I have the vaccine, so I'm safe. I will not get sick. That's wrong. You will get sick if you don't follow the safety and the hygiene, but the
Okay.
symptoms it will be less because we're dealing with the material. We're dealing with the part of the virus. It's a spike protein.
So my question, Dr. Ray, so when the virus go in here, it goes first to the mRNA and then it affects the DNA. Is that how it flows?
Okay. You talk in general or about COVID?
I'm talking in general because I'm trying to understand the job of the mRNA and how it affects the DNA in order for me to
Okay.
explain this because I'm still not getting it myself. So,
Okay. For example, we have 365 different type of influenza. Okay.
okay,
When you get sick of influenza, your body builds immune against this type. So after you get sick, you will never get sick from this type. Okay. If you get measles when you are young, your body builds the code from this virus. So if you sit again with people who have measles, you will not get sick because the immune system gets the code. The problem with COVID-19, our body can't take the code and save it in the memory for long. So all the studies showing maybe the immune system save the code of COVID for 1 month to 3 months. But after that, you can get sick again and again and again because
mm,
our immune system can't hold the code of the virus for a long time. So the vaccine here, they create the vaccine to prevent the symptoms, to prevent the symptoms, to eliminate the amount of the protein the COVID virus built it in our body.
okay. Uh, you're saying that the vaccine is to prevent the symptom, the amount of protein in our RNA. Did you say?
In our body,
Okay, hold on. Sorry. Brenda, welcome. The amount of protein in our body. Okay. Brenda, welcome. Yes. Uh,
okay.
we're in the slide here,
Maybe,
and Dr. Ray is wanting us helping the help to also interpret, but he's trying to explain the DNA and the
maybe,
RNA. Yeah.
Yeah, I'm seeing it. Really good.
Yeah.
Yeah,
Yeah.
really
Go
good.
ahead.
maybe I'm explaining too fast. Okay, I will make it
Yeah.
very simple. Okay,
And
we
please
have.
adjust your microphone because it's static a little bit on and off sometimes, because I could not pick up sometimes.
Okay, I will explain it in very simple way. For
Yes.
example, DNA, that's Emeline. Okay,
Okay.
the mRNA, that's Brenda.
Okay.
Okay? If Emeline won't talk to Brenda or Brenda won't talk to Emeline, they use connection. Yeah,
Right.
Yeah,
this connection may be a mobile phone, maybe a landline. Yeah,
yeah,
maybe Facebook, Zoom, whatever. But there's a connection here. Yes,
yes.
Yes.
this connection here, that's I can call it vaccine.
Okay.
Okay.
Okay, so the connection here or the vaccine in three levels. One dealing with the virus straight away, the whole virus, like you met Brenda in reality, maybe on coffee shop or something. So here, the first level, we're dealing with the virus straight away. So we take the virus, we make it weaker, and then or dead virus, and inject it to the people. So the people here, the immune system, the DNA from the injection start to get the code of the virus or the dead virus and have the code in the memory. So in the future, if this virus go inside your body, the DNA already have the code of the virus, which is now the DNA respond to the immune system by have sending the code to the immune system to have the B cells and the T cells attacking this virus. So you will not get sick again. So this is the first level of the vaccine. Clear now?
Uh, I think so. It's clear now, Brenda.
It's clear.
So what he's saying, the connection between the DNA, like myself, and then you, the RNA, is the vaccine. Is that right, Dr. Ray?
The RNA
We
like
call it.
Brenda. The
Yeah, we
connection between you and Brenda, that's
Yes,
how we build the vaccine.
that's how you build the
yeah.
vaccine. Yes, okay.
Okay?
Yes, we got that part.
So the first level of communication you met with Brenda in reality. That's we call it when you deal with the whole virus.
Okay,
Okay.
okay,
Second level of the vaccine, you just deal with the symptoms. Like Brenda in her home, you are in your home, so you can call by landline. If the landline busy, you call by mobile. If mobile busy, you will send her message. There is a lot of things you can do in this one.
right,
Okay, same as all type of vaccine we have here, AstraZeneca in this level, dealing with the symptom. So this to prevent the symptoms of the virus inside our body. Like, okay, Brenda's busy, I will send her message. So when she get the message, she will respond. You get the
right.
idea now?
Yes,
So
get
the
the idea.
vaccine here to prevent the symptoms. So
Brent,
our body, we don't have the code of the virus, but we have another material respond to our DNA, to our immune system to start eliminate this type of the spike or S spike protein made from the virus in our clear or not clear.
yeah, I think we got that clear. Brenda, kapag ke fatong ay kumaka meko ne hinga mai ko kiai ko vai ko vaccine ko na ngau hi pe ya can hang I think the bottom line is can hang prevent I symptom can hang ke tau malu I tau tolu me symptom
but not the cure. We kai ko fight to
yes, it's more a preventive,
preventative. Yeah.
yes,
Yes.
preventative of the symptoms,
Yes. I
I
So
think
got
we're
you.
good on that one, but Dr. Ray, and I'm pretty sure a lot of people just picking up very well, and I think we should be good on that one. You can go ahead
yeah,
and
I tell you what, because for me, if you understand the basics or the very like ABC information about how any
right,
vaccine in general work in our body, there is a three levels of vaccine,
right,
like measles, chickenpox. We take the virus, okay? We dead the virus or make it weaker, then inject it to the people.
right,
Because the end of the day, our immune system dealing with cold. So if I give you a weak virus, okay, or a dead virus, the end of the day, your body dealing with the cold. So the DNA save the code of the virus in the memory. So when you sit with people they have measles or they have chickenpox, you will not be aware or you not be scared that you will get sick because you already have the code. So if the virus enters your body, the DNA already recognizes it, send the immune system have the material to fight against this virus. So you will not get sick. Different story here. If you have the
Okay.
vaccine
Before you
and you
go
say
on to
to
that one, Dr. Ray, Brenda, I think mau ingat kita explain this one. Kung nilaw ko kihangay ko misele mo me ko ya, what they do, they take the virus o huhu ko kikakai. Ay ko time ko kumay ko mahaki o osinofo ay virus ya ko ya ihoto sino o lavay kini malu kita mehe mahaki. But o kaundepe eya ko COVID ya o kehe ya, eh? O
Okay.
tonu pe ya Brenda, eh? So the COVID is different. Go ahead, Dr. Ray, on that one.
okay, with COVID, our body can't take the code of the virus. So that's why it takes long time to have this type of vaccination, different type of vaccine. Okay. So
Can you repeat that,
AstraZeneca,
Dr. Ray? Did you say the COVID? What's the difference of why COVID is different?
can you put the screen back?
Yeah, is it I'm going back or going forward? I'm on. The
No, no,
screen
no,
is
no, no.
on.
The screen never changed. It's just stuck in this one so far. Put
This one?
our put us back so we can see each other, then we can share the
Okay,
screen again.
okay, I see. Okay, you want me to stop the screen? Okay, hold on. Let me go back in here. Okay, we're back. Do you see us? There you go, Dr. Ray. Okay, he asked me to put the screen out for a minute.
Okay, where's Brenda? I can't see Brenda.
Brenda is right there.
Okay, here we are. Okay, I'm trying to explain like in
Just
very
remember,
simple way.
Dr. Ray, that we don't have no clue of medical here, but we're trying to follow you. So the most simple you can explain this, the better. So,
Okay, when we are kids, our family took us to the family doctor or to the hospital to vaccine us. Yeah.
Right.
yes,
Right.
Okay. Before 2010, the vaccination about we get the virus, we make it weaker and inject it to you. Okay.
yes. Okay,
Because the virus is very weak, when we are kids, our immune system start dealing, get experience with the virus.
Variants.
okay,
So the general side effect of any vaccine, fever, swollen, where you get the virus, all the kids have it, yeah?
Yeah.
yes,
That's in general. So here,
okay,
this type of swelling or fever, because the immune system starts to attack the weak virus. But
okay,
2010, the vaccine changed,
okay,
and we gave the people a dead virus. Rather to give them a weak virus, we gave them a dead virus
okay,
because our immune system, once they go to this cell, okay, the stranger cell. So the virus for us, it's a stranger cell,
Okay.
okay? So when the stranger cell come to our body, the immune system start to attack straight away. Once they attack, they take the code of the genetic material inside the virus and keep it in the memory.
Mm.
So when this virus come again in the body, it doesn't matter alive or stronger or dead, the immune system have the code and start to tick, tick, tick. Like
okay,
if you want to call Emeline or Emeline want to talk to Brenda, they have the phone number. Yeah.
Yeah.
okay,
The phone number here looks like the code. I save it in my mind. But if I have short memory, okay, maybe you tell me your number now, I repeat it for you. But maybe after 1 week, if you ask me about your number, I can't remember. Yeah.
Mm.
Our body with COVID, any type of COVID, we have this type of short memory. We are not sure. There is no study till now showing how far or how long the immune system can hold the code or the number of
Right.
COVID.
Okay. Brenda, do you
When
wanna
people get
be
sick of
Dr. Ray,
COVID,
can we translate the one, Brenda?
but you understand this now very clear?
Yes. Now it's so clear, Dr. Ray, but I wanted to translate that one.
Okay.
Brenda, nakema
Yes.
ofe megani. Okay. Na pe to ta ki mo ko he wa no ho fulu.
Okay.
Ko fonga ko na na ai ko vaccine ko na ho to e foi virus o hu ga kita, eh?
Yeah.
O mahaki ko ya, eh? But after the 2010, oku na nga glem na to dead virus, eh? Còn này hu ko dead virus ko to sino. La vale kan ha e ma wa foi code. Eh? I no fole vai hanga de vai.
Memory.
Yes, like a code and og no fole vai ho to sino. I foi me ko ya. But I'm go how e mahaki. Og o si hanga de vai e mahaki ko ya. Hanga de vai foi code ko ya. That is that code stays in the DNA when
Of
they put
course,
in the
yes.
dead virus.
Yes.
Yes. So
Because
gonna no
your
ko ya.
DNA get the code of the virus already.
Right. Ko fa ko te ko virus si ko time ko ala te ko ai mahaki ko to sino o gu ya e foi ko te ko ya ne lava le vai ya ke ne hanga kumi ai foi mahaki ko ya o match up ya ko ma ko ne fa ke ya ko o ki mu a he wa no ho fulu mo ki mu he wa no ho fulu, and that's why ko le pe ko COVID is different, eh. I
Yeah.
So
think
once
we
it
clear that
matched, when it matched, Dr. Ray,
the
what
code.
happened then? If the virus go right into the code and match, is that a sickness that you are out of, or you're gonna get it?
Okay. The virus, any virus, have the protein, their own protein. So when the virus, any virus, go in our body, the virus start to make protein in our body. Okay. If our immune system have the code, once the virus starts, they attack the virus straight away. Like where are you going? Like when you go to America, you have to have a visa or you have to have the American citizenship, yeah,
Yeah.
Yes.
or American passport. So here, to let you in, to let you in, okay,
They have the
that's
code.
our immune system to stop
Mm.
you, like our border, to stop anything come to our body by know the code, okay.
Mm.
If the code familiar with the immune system will attack it straight away and you are safe. That's why we said like let your kids play around, not in very clean because you will destroy your immune system. Why we said that? Because the immune system here, they don't have the experience and the practice in reality to get more codes of different virus. You got it? That's why we said to the people, don't destroy your kid immune system. Let them
Okay.
go to the environment. Let the immune system get more code. You know?
Right. So how are kids destroying their immune system, Dr. Ray? By exposing to the cold, like you said.
Look again, the code that's our immune system gets. So, for example, today your immune system get code of influenza, get code of type of food poison, get type of bacteria or fungus, and your body success to um, destroy this type of bacteria, fungus, or food poison. So next time this bacteria or fungus or virus goes to your body, they can't because I already our immune system it scanned them and they have the code. This code will not
Okay.
allow. So when this virus come, we already have the scan. This virus will not come in. You
Okay.
got it?
Got it.
So this like a scan. We scan our immune system scan all the strain or the stranger. When they
Mm.
have the photo of them, they not alert. But if this photo here, if I don't have the photo of Emeline, you will be in. But if I have the photo of Emeline, you will be out. But to be in, our immune system take time to recognize that Emeline is a stranger in our system.
Okay.
And our immune
We
system
got
start to
you.
fight. You take antibiotic, you
Yeah.
take um, anything for this virus, okay?
Okay.
To it, the immune system start to identify the scan. So now, if immunity come back again, no way,
No way. Okay.
okay?
Okay.
With
We got that part.
COVID-19, with COVID, all the type of COVID, our immune system have like a fish memory, very short.
Yeah.
Oh, like
People
a
get
short
sick,
memory. Mhm.
yes, people get sick of COVID-19 and then they get sick again and again and again and again
Ah.
because there is no code in our body.
Mm.
All the study till now we are in 8th of August 2020. We are not sure how long the immune system can hold this code. So people in the first wave, they say, "Oh, thank God I'm still alive. I will not get sick again." This thought come because the immune system will hold the code of the virus.
Mm.
But the second wave, some of these people get sick again. Okay. So even if you take the vaccine, you are not safe.
Mm.
If you take the vaccine, you are not safe. The vaccine to prevent the symptoms.
Okay.
This is clear?
Yes.
Yeah.
Brenda, I think I love our for ton le ai nei hinga ko ni.
Mm.
Ogne pehe ia ko COVID tiu ke he ia Hange ko ngalo ngalo eh.
Mm.
Aya ko hau ko ula ki ia. Ne ngo pe ke si hu ko ia. He ke mana tu ia he tau pe immune system. Ko hinga ko ke hu ai ko ulaki pe hu a ko pe fa ke po ke ai he na ke fa o a vaccine ke ne hanga o faito na fa pe ke prevent but at the same time ko COVID ia o more like a short memory ai ko loto ngal ngalo ya ai ke tem ko hu te virus ia ko sino he ke na ya mana tu I o ai nda ia vaccine da ke si kamata ki ho first one. So it's more like a short-term memory. I'm trying to explain this in Tonga. It doesn't matter if you already have the first dose or have the second dose. This thing have a short memory, might not recognize that you have them, and you still can be sick. Yeah,
Yes.
that's my
But
understanding, Dr.
here,
Ray.
here, here the idea. Here the idea. When you get sick, the symptoms will be less. That's what all the studies so far showing us. But
Okay,
it's not showing us maybe you need the third shot. Maybe every year you need another shot. Maybe every 6 months you need another shot.
okay,
So far,
Yeah.
we don't have a study showing after the second shot how long. Maybe you don't need another shot. Maybe yes, you need another shot. Maybe. But I'm talking now about what is the current study showing. Again, I'm here not push people to not take the vaccine or take the vaccine. I'm here to explain. My opinion is my opinion to myself. I'm here to make everything clear to everyone.
mm,
Okay? I want to go back to the slideshow.
sure,
I want to go to the component of AstraZeneca because this you go to the slideshow till you see the photo of the chimpanzee.
okay. Hang in there. Let me go back and.
But Yeah, there is a slide before the chimpanzee one. Yeah,
Okay, this is where we at now. So can we continue?
yeah, go down, down, down. Tell the slide before the chimpanzee. Go down,
More?
down.
Okay,
Yeah,
this
this
one?
one here. See here? No, no, go back, go back. Yeah, this one here. See here, when someone is vaccinated, they are very likely to be protected against the target disease. But no one, no, but not everyone can be vaccinated.
Mm,
This is very important. When the government try to put the law and they want the public to be respond, this from the World Health Organization. Not everyone can be vaccinated. Okay,
okay.
I want this to be translated in Tonga
Yes.
before we go and talk about the
Brenda?
component of
Going,
AstraZeneca.
Tela ba fatong hain?
um, I will try,
Okay.
Kaku. Okay, um,
E
because I
whamea no
did,
anta line ni koe ni lana kula.
iyo, koe uhinga mai befokia, ai toke tā koe taimi ko, ku hoho ai, ahani ihi, he?
Mm.
O common knowledge o me mihange beia o protect kin outdoor against ai foi mahaki peko ya tau peko misere eh tau peko against targeted disease ha foi mahaki peta but not everyone can be vaccinated eh kapau
Ko,
kai ke fie hu ko ia ko hare vai ai ko fie ira pe ko hare vai ai mahaki underlying health conditions o
uh,
kukai ke it's not taken care of ka ko immune system level ni weaken it kakai ko ya ko kai ke
uh,
hange ko HIV kakai ko kai ke hu
I, go ahead, Brenda.
no you go ahead Emeline because
Iyo,
I'm
ko foi me ko ni ko foi ko hawan me WHO ka ko foi I think what mau inga
herd
ni I foi
immunity
me ko no anta line ni
yeah
ko vaccinate o guai fa hinga ia o ku o guai fa hinga e ko ke sai kana dolu ai hu. Mai I think that's the bottom line. Right?
okay
So they're trying to make this as like mandate for the entire people, but there are people can not everyone can be vaccinated. Aya kono
Yeah,
uhinga ko ta ko
and
to pe ku ke ho ta immune system.
in the
Aya
main,
yeah. I think that's the
in the
most
same page,
important thing.
in the same page here, no single vaccine provide 100% protection. You see, in the same page, the 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 last paragraph, the one
paragraph yeah
above the last paragraph, like this is especially
especially
important for those people who not only can't be vaccinated by, but may be more
the
um,
susceptible to the
the
diseases
disease we vaccinate against, but no single vaccine provide 100% protection. See, this is the main thing. This vaccine to prevent, not for protect. So if you get the vaccine, that means you will not get sick. No, you'll get sick if you not follow the hygiene and keep distance and all this structure. The vaccine here to prevent the symptom, not to protect you 100%. The vaccine here, people they shouldn't take the vaccine, like people with cancer, people with HIV, people with the fistful lipid syndrome, like if they have autoimmune disease, people they have a history of stroke or blood clotting. This is big. No, no, no. And so far, I didn't see in this law. The law must be aware. If you want to put law, you have to be aware of all these things from the World Health
Yes.
Organization.
Yeah, Dr. Ray, that paragraph itself is telling me something, that we are grouped as herd, like we're some kind of animals or something. Herd immunity, meaning some are vaccinated, some are not. And some will get it, well, they're not even, what do you call it? They're not even guaranteed that they're going to be cured, right? And some, see, just when I see the herd immunity, it's almost like an insult to me that we are compared. It's almost like a herd of cows, that we're not even sure if what we're being vaccinated against will even cure us, like I have, right? Now I'm asking question. Now I can see clearly what you're trying to tell the people. We should not just jump in like a herd of cows and be vaccinated to get better milk for us to live, But I, I don't like the herd immunity. I like it to come out straight like you're saying. You're saying we are not guaranteed protection 100%. And these cannot, people can be vaccinated, but herd immunity, it's not human to say herd. Herd is herd of cows, herd of buffaloes. Now, first time I hear herd immunity, and it's referring to people.
I tell you what, this from the
Yeah,
WHO.
this is from the WHO,
I
Brenda.
know
If you
I
that.
look at it,
didn't create it.
uh,
And
Dr.
No,
every
Ray,
information,
I wanted to kind of my understanding on this one here. Every immune system is built differently, so not everyone is gonna be uh, accepting this virus. I mean, this vaccine and good for themselves. So I am gonna bottom line go ahead, Brenda.
yeah.
Kia tonga, ko tau sino o ke he ho tau sino. E ai whahinga te nau sai ka nau tole vaccine, e ai whahinga e ikai sai ka nau tole vaccine. Ka koe mea koe kuhinga mai koe ki ai koe a Dr. Ray, ka kai koe nau whao koe lao, ke mua ke nau whao koe lao, whe mau ke nau wako ka nau tō ke nau iloi ai mea koe ni. He koe ngā e kuna hang tō whao e lao, ke mandate ki he tāku tō pe ke nau vaccinated. Ai ana makamata mai a ki koe ai lao koe tonga, o si hanga e nau tō whao e lao i tonga, o whakanganga ke nau hanga o whotu e lao koe ni, ko pau,
Mahino
yes,
aupito
yes,
Mahino aupito
yes,
ni lau po o si.
koia,
Pamea penia ko o kai ke sai ke whanongo.
koia,
Na kai ke mahino no talamai, they did not even give us any
information, right,
explanation to the rights that we have if we wish to take it or not. It's
right,
almost like they're saying, take it because you're 60 and over. You know what I mean?
right,
Take it. And it seems like we're being the targeted people to be tested as guinea pigs on these first sets of vaccination. I'm concerned. So now I understand what Dr. Ray is doing, and I'm really on your side
I
because
appreciate
this
that, for
here,
sure.
ill.
Malo. Now we go to the second one because it's very important.
Yes,
Oh, gosh.
Yeah. Okay. Here, a lot of people ask, what is the component of AstraZeneca? You have right to
Seneca.
know.
Is
And these
Seneca?
people, they come to me and they said when they ask the doctor in the hospital or the nurse, no one knows. And this make argument in the on the public. Here, first thing, adenovirus. Okay, this the active ingredient of AstraZeneca. Okay, and I will stop here. I will stop here in this one. So here, if you remember previous talk, we don't have here the COVID-19. We don't have the COVID virus. We have adenovirus from chimpanzee. Why?
Chimpanzee.
Because the S spike protein from adenovirus similar, okay, with the S spike protein from COVID. But the similarity here is less. But at least you get like 70% of the protein from COVID similar to the adenovirus. That's why they said the vaccine effective 80% or 70%. But here the effective ingredient, the messenger here, we take the messenger from the chimpanzee, which is the mRNA taken from chimpanzee to our DNA.
Oh.
So it's not the messenger from our RNA or from human RNA. The messenger here is being taken from chimpanzee, from
Huh.
different virus.
Can you
So,
hold right there, Dr. Ray? Because this is really, really important that we have to explain this. Ko 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 ha ko ni. Tao pepe ko fa hinga ni ngeri Brenda eh.
I'm not
I
like
have now
it.
chimpanzee eh. I go now ha na to o. I what
DNA.
do you call this one here? The virus from this type of
it's
monkey.
called adenovirus or adenovirus.
Virus.
Adenovirus eh. O to ole vaya me yai. Ai kwa ke to em he tau mRNA gu NA ko tau tolu ka ku to em he mRNA ko o ngeri ko ni o maya ke tau DNA. I mean this is like whoa, Dr. Ray. Uh, I just hearing this now and it's this is amazing. I mean, this is like something that is really, really need to be, the public need to be really educated on this, you know?
Okay. And then I will talk about what happened here, but let me finish all the components. So
Sure.
we have the second component, amino acid. For me, it's perfect. And then we have the hydrochloride here. This, the one was some of one Trumbull's talk about the hydroxy.
Mm.
Then here, I have a problem here. Sodium chloride salt. So if people have high blood pressure and you give them two type of blood pressure medication to lower the blood pressure medication, this will not be a good choice for them.
Wow.
You got it now?
Yes.
Sodium chloride. Then you have magnesium chloride salt. You have sodium EDTA salt. You have sugar. So people with diabetes, okay? And you
Mm.
have the alcohol.
The
Oh
alcohol.
Lord.
How many percentage of that?
Well, till now, that's a problem because till now the FDA asked Oxford to give us the data. Until now, it's not clear.
Mm.
And in the 30th of July 2021, which is just like last week, still the FDA didn't give approval to the AstraZeneca. So there is no AstraZeneca in America, in the
Mm.
United States, because there is a lot of studies missing. When we go to the active ingredient, I want you to play the Prime Minister Australian, the link I sent to you.
Yes. And before that, let me really translate this one here because I think this is so important. Kami ko na mo siya ko kaya ko ingredients and ko ihe huhu ko ni ai COVID ko ni. Na tabla me ko Dr. Ray ko kimu ana ne pehe not everyone can be vaccinated. This is the reason why not everyone can be vaccinated. He kono hinga ni. Ko ta ko a component ko ni pe ko ngai me ko ni. I have vaccine ko ni. I hange ko sodium chloride. I ko salt ai. Ko masima ko ni. Aku COVID ke to ta ko high blood pressure. Kapag ko okay high blood pressure. Ko huwat ko vaccine ko ni e ka COVID ka ko. Hange ko ni asa suka. Kapag ko o kung diabetic, this is not gonna be good for you. Ko uhingan ko na labi ko at WHO ko aninay, not everyone can be vaccinated is for this reason because all these components in this vaccine o kung kehe vaya is some people gonna take it okay and some may not take it okay. Hange ko na go high blood pressure, hange ko na go diabetic, ko kakaya ko yaya ikaw ko vi kana to vaccine ko ni ko nga ingredients ko vaccine. And I think Brenda, if you have anything to add to that one, I think those are very important
Yeah.
hanga o
I
fatonga
want
iki
to add one
kakaye.
thing. I want to add two things here. People with kidney failure, they shouldn't take AstraZeneca because the amount of salt. Because people with kidney failure, we try to balance the salt in their body. Otherwise, that will cause fluid retention.
Who are these
Dialysis.
people you saying, Dr. Ray? What type?
People, they have kidney problem like kidney failure or people in dialysis. They
Ah,
shouldn't take because the amount of the salt is high. People,
right.
they have the problem. We try to eliminate the salt in level in their body. So people with kidney failure, that can cause death.
Hmm. Ayaw ka pa nga ko ni hangin ko ni mo kapag mo dialysis. Kung COVID au pita ka mo tol ko nga ko masima Brenda. Te
Yes.
hatana ki mai
Yes.
ki ai.
Oh my gosh, I am numb.
Mhm.
I'm numb because these components never at any time the scientists brought it down to the front workers, doctors, nurses, that there is such component that you can, compare with what you're taking, and and the vaccination that's in your body. This component is afterwards is a knowledge after the fact,
Yes.
and it's
And
kind of
and for
scary.
those who why kong ai why alcohol or why I kong ai ko alcohol kana tol kon ko kwa kinao uh tape kwa kinao inu o now you have some kind of alcohol in this vaccine okay
Okay.
Dr. Ray we're gonna
Let me explain to you something here for the alcohol. When we do chemistry, sometimes we need to use a major connector to connect all these type of material in one component. So we use the alcohol. Sometimes we use the alcohol as a major connector. And here the alcohol is a major connector.
hmm
This for me, people study chemistry or biochemistry. When they see this component, they will know exactly for sure the alcohol here is using to hold everything, to hold the difference between the amino acid and the difference between salt.
hmm
So the alcohol is major connector.
hmm
And very last component, the water here, it's a minor connector. When we do chemistry, uh, we studied this type of level of connection. So we have minor connector. Here we use the water as a minor connector,
hmm
and the alcohol here is a
it's a
major connector.
major connector
So when we make compound, any compound, we need to use connector. Some like when you have the crane, the major connector of the crane is fat. Otherwise, it will not be a crane. You get the idea. So the
okay
alcohol here, as a chemistry, when I see in the component, because I have the medical background, like I have the science.
right
We study chemistry, we study biochemistry. So in alcohol here, when I see component of um, the vaccine here, when I see alcohol and water, so the alcohol here will be the major connector and the water will be the minor connector. That's the very important. Okay.
So my question to you, Dr. Ray, what is the major connector and the minor connector job? What are they doing for this component?
The major connector here to hold the component to each other, like in a one unit.
Okay.
Otherwise, if you put this
Like the
amount of cells in a
mRNA
water,
and the DNA. Yeah.
Okay.
okay, here we are.
Okay.
In the chemistry world, we have something called carbon bond and hydrogen bond. Okay,
Okay.
so when I have the alcohol here, actually it will give us the shade of the carbon atom inside the component of the vaccine of any medication. Okay, we use here the alcohol because the amount of the carbon atom. So here, the alcohol will be as the carbon, what you call
All
the
right.
carbon bond, which is very strong. So if you put this type of salt in a water by itself, okay, it doesn't work. We need another component here to make it not, because the water, we have hydrogen, we have oxygen. So the component here will be demonstrate with this different type of salt. So we have the magnesium. I need the magnesium chloride to be by itself. I need the sodium chloride to be by itself. Okay. I need the sugar, okay, to be by itself. So here, the alcohol here play the main role,
Mm.
which is here why it explained to us why AstraZeneca, the vaccine, do not need to be diluted because of this type. They use the major connector and the minor connector in this compound. Because for
And
me, AstraZeneca is a compound. We have effective active ingredient. We have some component here. For me, it's compound. You got
okay.
it?
Yes, got
As
it. So they
any,
don't need to dilute it, eh? So okay, because of
they
the
don't
using
need
the
to dilute
alcohol.
it because they use
Okay.
here two major connector. And
Okay.
when we talk to the other type of vaccine, we will see like Pfizer, they need diluted because they just use one connector in the compound, not major
Right.
and minor.
Okay.
Okay.
I am
So
Brenda.
now, yeah,
I think
explain.
it's so clear on that one, Dr. Ray,
Yeah.
because
Yeah.
cái alcohol cái for the main connector có này hàng có puke ngay for I ingredients cái ní ai cái major one cái alcohol cái minor one cái vậy
Water.
ai cái mấy cái ní có whole cái alcohol pa cái cái tôi phải cái dilute ai cái dilute cái này tôi hàng for vậy vậy yeah.
Very
Aya
good.
ko tu tani mi ok malo te ko pe hono ngai ko o ka holo ke ne connect me ko ni. I think Dr. Ray we clear on that one. You want me to play the video?
Yes, please. And then
Okay.
after the video, we'll continue on the slideshow because the second slideshow
Sure.
explain about the adenovirus. What is the adenovirus?
Okay.
Okay.
This is a very good evening to have all this understanding about the vaccine. Okay.
Australia has cancelled the production of a domestic coronavirus vaccine after trials showed that it could lead to false positive tests for HIV. The developers of the drug, the University of Queensland and biotech firm CSL, report that the vaccine did show a robust response to combating COVID-19 in a phase 1 trial, but finding a fix to the HIV problem could take another year of research. The vaccine was one of 4 candidates contracted by the Australian government. CSL and the Australian government had together decided to stop phase 2 and phase 3 trials. The government has instead secured additional doses of rival vaccines, such as Novavax. Meanwhile, pharmaceutical giants Sanofi and Britain's GlaxoSmithKline's candidate have also reported setbacks. On Friday, the companies said that clinical trials showed that their own vaccine created what they call a, quote, low immune response in older people. It means a potential vaccine launch from them may be delayed until the end of next year.
Okay.
Wow.
So if why this happened, if you go to the second slide show, after the explain what
Dr.
because
Ray, your microphone is kind of static and on and off.
sorry the internet.
Yeah, now we can hear you better.
Okay. So if you go to the
The
slide show again,
PowerPoint, the slide.
the one
Okay.
yeah, the PowerPoint after the monkey one.
Okay.
Actually the chimpanzee, not the monkey.
Oh,
You
Yahweh.
See if I
It's,
can.
man, I'm in awe, Dr. Ray.
yeah. This when we studied for health practitioners to give a clear idea to the people. That's why we have different type of vaccine, and
Okay,
not
so
each.
we go to this one. The slide is back on the screen.
I didn't see it. Can you see it, Brenda?
I see
Uh,
it. AstraZeneca and
Yeah.
adenovirus.
So
adenovirus.
Adenovirus.
Dr.
like
Ray, you may just need to go back to your Zoom because it's on the screen now.
okay. So um, here it's like cough the like it's spread by the respiratory when people
Respiratory.
cough or sneeze. Okay.
Okay.
Like symptoms of cold and flu. That's the adenovirus.
Okay.
But
Adenovirus. Okay.
adenovirus type 5, okay, this type of infection, it's increased the risk of HIV infection. Was
Mm.
also observed, okay, when the man enrolled. So here, another story about how the risk of HIV. And when some people take the vaccine, it's showing false. Because when the prime minister said it's false positive HIV, that's a lot of people, they don't understand this thing. But this false, it will take time and go. So we have here some of the study and documented that because it's come from chimpanzee, there is a high risk of HIV infection, but it's false one. We are not sure how long it will go, like the Prime Minister said, the Australian Prime Minister. You get the idea now, you understand what happened?
Yes.
Yes.
Brenda. Cái adenovirus yan na mati phong na to for ke mi he nge di ye. Ai
Yeah.
ko inga ko la vai ko ke increase the risk of HIV infection
Oh, yeah.
this is scary though. To know this because ko matu ko adenovirus ko component ya ko AstraZeneca
Oh, yeah.
or vaccine ko ni
Oh, yeah.
Okay, Dr. Ray.
Okay.
I think we could.
Um, the second slide, so we
Okay,
have,
the next.
yeah, we have here the common side effect. This very common to any type of vaccine, like feeling tired, tenders, bruising where you get the vaccine, headache, muscles pain, joint pain, nausea, sometimes fever. This has any type of vaccine. Okay, and then
Wow.
the the other one, the second slide show this rare side effect.
Okay,
Uh,
hold on, Dr. Ray. Let Brenda ilabake fatonga America ni. Ko side effect and ko AstraZeneca,
Seneca.
Ko
Yeah.
yeah. I got
Ko,
common one.
eh.
Go ahead, Brenda.
Ko ngai me e hoko ko ka kita, he? Ko
Go
te
yeah.
hela ia, te ongo I hela ia, feeling tired all the time.
Yes.
Pe aho vare pe ko kamata ke ase a ngahi bruises ia. Hange ku uri hato pe ku uri hato kiri. He? O hange ha kapag te tuki I hataha. Pe e ase a bruises ko ya. Ko ha whatonga bruises.
Go Well, I don't
Oku
come up
lelive
with that.
mak hotosino.
Yes, yes.
Pe oku te
Wahu
toi mak
utawi
lang
pa tonga ko takauri pe
taka
ko
uli.
ko
Yes.
ya.
Pe oku te toi mak mo langa. Pe
Uli.
very au pito hoto uma. He
Ko
mea
ya.
koe na e whai ai huhu.
Ko ya.
Pea koe mea rewa kau koe langa hoto ulu. Pea moe langa hoto maso.
Wowa.
Uoua.
Mhm.
Pea moe hoko anga hui.
Yeah. Langa
O
hapa
moe
ha hoi.
tui. Pa ku te ngoi te mi lua.
Ko ya.
Pea pa te hao rewa pea moe fever. Temperature. Aia e lava pe o alu o tolu valu,
E Celsius ia ka ko tau tolvo ko ne over ko he iwe hiwa ko mofia,
Koe mofia,
Yes. A temperature ko na tau
Io.
tolu. Ko ne over pe hiwe hiwa ai ka te au ko mofia,
Koe mofia, io. Ka ko mea whakairifia au pito ke whanongo. He ke ilo na osko ni huhu. O kai ke ongo e au e hela ia. Most often, ko toke hela ia pēr ke he whiawhi. Ka ko mea ko ongo I oho ware pe fo I muscle pain ko na utalatu. So ko tō whana. Na utalatu ka koe na ana oho ware pe ko ngai o pe au ia ko hat a teke.
Koia,
I muri tu a. Muscle pain ia I tu a. Whahai tō he mai. Right above the bone,
Koia.
I to tō. Ko foi mea pe ko ongo I ka ku. Ka ko ilo I na tonu pe ke hao o mea koni ki mua
Yes.
I he huhu.
Koia.
Ana tau rush foke mea ko toa for a purpose.
Yes.
Rush ko hinga kulakange pe no hu ki tau tol ki tau kau. Ha tau lere ia ki tau tol wharimahak pakai ki tau tol foke make up. You know what I mean?
Koia. Dr. Ray, just Brenda was just explaining, because she took the vaccine, and I think one of the side effects over here that she experienced is the muscle pain. So
Yeah, because I tell you what, that this side effect is common for any type of vaccine, not even for AstraZeneca. This for any type of vaccine. Okay, but now we have the second slideshow, the rare side effect.
The rare side effects. Okay.
Okay.
So the rare side effect here, it's very important
Okay.
to understand.
Brenda?
You can translate it to Tongan straight away.
Koe AstraZeneca side effects, pa to ia mo rare side effects,
Koia.
Koe uhinga ia o kuia ai ngahi langa ia pe koe ngahi hange koe pupula pe koe lua mo mea. Koe ngahi mea ia o kai ke wha asi mai, Hange unau toi toi pe. Ka oku kau pe ia I he konga koe ni oe mea ko hoko mai ka ki tahe o se ai huhu. Aia koe redness. O vai pe kukula pe a pupula hato feitu he osi ai huhu.
Koia.
And I didn't see that on mine.
Is this the area where the shots at, Dr. Ray, or can be anywhere in the body?
No, where the shot?
Okay.
Where you had the
Yes.
injection.
Aia ko pupula ko ni mo kula ko ni e hoko pe he area ko na fai huhu. Aia ko whakalele, ko lua, Ai ko low platelet count ko ni ko high. It don't cause the symptom. Can you explain the low platelet count, Dr. Ray?
Okay. Here, I put it as AstraZeneca was explained. A low blood plate count, because
blood
at the
count.
end of the
Oh,
day,
low. Okay.
I have to be fair with all the information. But when I explain here that the blood plate count, when it's come down, that can cause clot, can cause a stroke.
Any symptom.
And when we go further, But what the plate count? The plate count is very important because that's where the hemoglobin and oxygen and the enzyme going through your body, through the blood. So the blood plate, like if you have a plate and you put fruit or you put food, but you have a plate. So if you have limited plate, so that means what your body carry is less. That's why you
Yeah.
feel like tired, sleeping,
Iyo.
sweating. You got it?
Iyo.
Yes,
Iyo.
ai ko hawa ko ni ko te hange te vai vai ya pange te me mo he pe time ko to ai.
Iyo.
Ai pa pem hange ko me holo te appetite.
Iyo pete ninimo.
Dini mo pe te ki
Pekaige
mohe
te
mohe
ke mohea. Iyo sleepiness.
sleepiness eh.
Hange ko te mata mohe pe.
Koya.
Yeah.
Pemo is sweating.
Koia.
Yeah.
Pupuha ia. Te
Koya.
pupuha
Pupuhaya
ia
mo.
noa ia. Iyo.
Koya.
Pemo swollen lymph glands.
Mm.
Eh?
So people they have, especially women, they have breast cancer. Okay,
Yeah.
they high risk to get swollen more. Or people have like chemotherapy.
Yeah.
Okay, and the lymph node, or they have surgery of anything of the lymph node. This can put them in a risk to have it. But this the second level of the side effect. We
Okay.
have here the third
Pemo
level,
rash.
which is the very rare side, not the following slide show.
Wow. Oh
Blood
gosh.
clot, and here they said here very rare side effect. Why? Because the percentage 4 in a million, so each million get the vaccine, there is 4 people get stroke or blood clot. But for me, to be honest, not everyone recorded. Okay. Um, I have here patient from Iran. They took the vaccine 2 hours later, stroke. And when the family and the patient complain about the vaccine, the hospital respond, we are not sure. But this time, it's not like we are not sure or we don't know or don't speak. No, everything must be clear. Okay. There is a cases of blood clot. And when we go to the second, the following slideshow, AstraZeneca being suspended in 24 countries of this issue.
Wow.
Yeah, go
24
to
Wow.
countries
the
suspended it already?
what?
Did you say 24 countries already suspended?
Yes,
Mm.
that's include German, French. Go to the second slideshow, the following one.
Denmark, Thailand. Wow.
If you press in any of these links and you have internet, it will appear to you straight away. Okay.
Yeah.
And there is some YouTube here. If you go to the last slideshow, yeah, the last slideshow, why AstraZeneca suspended. That's a YouTube. If you press any of
Yeah,
this,
let me stop that.
yeah,
Did you? Okay. Uh, let me go back in here. This is a lot of information, and this is a very important. Uh,
yeah. I want everyone to understand. So when they do the right thing, they know exactly what they want to do. Because
Yeah.
before it's argument. Arguments, you know, blind lead blind, as the Bible says. They both will full of the hope. Okay? Everything
yes,
must be clear. We have different type of vaccine, not only one. And even what it's good for me, not good for you.
yes.
And everything must be clear.
Is this the last slide, Dr. Ray?
Yeah.
Yeah.
If you play, you can get the YouTube, let the people listen to
Do
any of
wait.
these YouTube.
Oh, do you want me to play this one so we can listen?
Yeah. Play
Okay.
any of these.
Okay.
And those are most recent. Those are just lately, as of last week.
Okay, so we
And a growing list of EU countries.
Yeah.
do you guys see it, or it seems like my screen says it's not? Do you guys see the screen?
Nothing come out of screen.
No, nothing.
My age, younger people and older people. And the benefit
Can you
is
guys see it
strongly
now?
in favour of...
I can hear the poll,
AstraZeneca vaccine.
Yeah, for some
Germany-
reason, let me.
but at least we can hear the poll.
Real.
It's I have it on the screen, but I just need to.
Yeah. Bring it up.
Yeah, I need to bring it up. So
Very interesting, Dr. Ray. It's a scary thought for me after taking both vaccination. Can
But
you imagine?
remember,
okay, I'm
yeah,
gonna.
I have my sister in America. She took the 2 shots and she get sick.
Okay, I'm ready to play this.
Because of fears about possible side effects, including blood clots. The AstraZeneca vaccine has already been suspended in the Netherlands, Ireland, Iceland, Bulgaria, Denmark and Norway. Now, the World Health Organization, along with the EU's very own medicines regulator, say that there is no justification for this temporary ban, and leading British scientists insist that the vaccine is safe. Our medical editor, Fergus Walsh, has the latest.
Is the AstraZeneca vaccine today okay?
Good.
A public display of confidence in the Oxford AstraZeneca vaccine from Northern Ireland's chief medical officer today.
Well done.
By contrast, you can't have the jab in the Irish Republic, in France, Germany, and a growing list of EU countries which have temporarily suspended its use.
This is a safe, effective vaccine as recommended by MHRA. And let's remember, this virus kills people my age, younger people and older people. And the benefit is strongly in favour of people getting this vaccine at this time.
The EU vaccine rollout was already lagging well behind that of the UK. France has said it'll wait for a safety analysis from the European Medicines Agency due tomorrow before deciding whether to restart using the Oxford AstraZeneca vaccine.
The decision which has been taken is to suspend as a precaution vaccinating with the AstraZeneca vaccine in the hope that we can resume quickly if the opinion of the European Medicines Agency allows.
10 European countries have temporarily suspended all use of the Oxford AstraZeneca vaccine pending safety investigations. Germany, Italy, France, Spain and the Netherlands are the latest. Ireland paused at the weekend following Denmark, Norway and Iceland. Several other EU countries, including Austria, have stopped using certain batches of the vaccine. That still leaves several EU nations using the jab, which has been approved in over 70 countries around the world. AstraZeneca says more than 17 million people in the UK and European Union have now had its vaccine, and fewer than 40 cases of blood clots have been reported. It says the risks of having a clot are significantly lower among those who've been vaccinated compared to the general population.
We know that blood clots are remarkably common, and we'd expect them to happen in 1 to 2 people per 1,000 per year, which is actually a very large number and much, much higher than the sorts of levels that we're talking about in these particular reports.
Scientists in the UK are frankly baffled by the decisions made in the EU. There's concern that the pause in using the AstraZeneca jab will cost lives because people won't be protected from COVID, and that it will damage public confidence in a highly effective vaccine. Fergus Walsh, BBC News.
Let's talk a little more about this and join our Europe editor, Katja Adler, in Brussels. Katja, plenty of reports from across the EU of vaccine hesitancy, and it's getting worse in some areas. So this isn't going to help, is it?
Well, absolutely not. And if you think about the AstraZeneca jab, Hugh, there was already quite a lot of European hesitancy around it. And that is due to mixed messages from a number of European leaders earlier on in the year as to how efficient they thought the vaccine was for the over 65s. Add on into that the fact that many in mainland Europe, Hugh, are much more vaccine wary than the majority of the public in the UK. So yes, European governments say they realise how sensitive their decision is if they've decided to temporarily halt the rollout of the AstraZeneca vaccine. But they say actually they're trying to do it to restore public confidence, Hugh, while it's being investigated. So we're seeing country by country inside the EU and the rest of Europe making this decision, but they're waiting for a pan-European verdict. We heard there from Fergus, from the European Medicines Agency. And while it's investigating those reports of blood clots, Hugh, it says that it thinks that the virtues of the Oxford AstraZeneca virus far outweigh any risks because the EU needs vaccines. It doesn't have enough of them anyway, Hugh, because there's been problems with delivery, and even with the vaccines that the EU has, many countries have had lots of stumbling blocks with their national rollouts. The EU lags way behind the UK, the US, never mind Israel, with trying to get jabs into arms. And all of this while many European countries are facing the third wave of the coronavirus. Just look at Italy reintroducing restrictions just today.
Katja, many thanks again. Katja Adler there, Europe editor in Brussels. And just to pick up on the last point Katja was making there, as we were saying, Italy is one of the countries suspending the use of the AstraZeneca vaccine. And Italy is now facing a third wave of the pandemic with a sharp rise in the rate of infections. So the government is introducing new restrictions, including the closure of schools, shops and restaurants. More than half the country is affected. And for 3 days over Easter, that's in early April, there will be a full national shutdown, as our correspondent Mark Lowen reports from Milan.
For 95 years, Guido DeNardo's family have dressed the men of Milan, his boutique passing down from his grandparents. But these 12 months have ruined him, with losses of 75% and now closing for another lockdown. Even Europe's fashion capital is fraying.
I hope we don't have to shut down completely, like so many others here. When I think of how this shop was my parents' and grandparents' life, it makes me want to cry. I'm only staying open for my children. If it were up to me, I would have given up already.
A third wave, fueled by the British variant, has closed shops, restaurants and schools in over half of Italy's regions, including here in Lombardy, where Europe's first wave exploded a year ago. For families, it's like being stuck in time. For the COVID generation, it's like time stolen.
We feel pretty dreadful. It's like back to square one after a year. It's incredible that the government, the schools haven't had the chance to think about an alternative. We look at Israel, we look at the US, and we look at the UK thinking, wow, things are working there. Yeah.
And here?
Not really.
Turbocharging Italy's slow vaccine rollout, this drive-through centre opened today in Milan, the government pledging to almost double daily jabs now and triple them by mid-April.
Well, Italy is finally in full vaccine mobilisation, but there's frustration here that it's taken weeks to get to this point. Yes, there have been supply problems, but only now are the drive-through starting and jabs also in schools, theatres and gyms. In the race between vaccine and virus, there's a feeling that Italy has let the latter win for too long.
Yes, that's right.
After vaunting its vaccine increase, Italy halted AstraZeneca.
We're going to end this one here? Okay.
Yeah.
Go ahead.
Let me explain the conflict.
Sure.
As I said at the beginning, when people take the vaccine, they said we are protect 100%. No, because the vaccine is to prevent the symptoms.
The symptoms, right.
Yeah.
It doesn't cure it. It doesn't cure.
No, it just prevents the symptoms.
Prevent it.
But prevent the symptom, 80% success. So there is still 20% from the people who not success. There is some people, they can't take the vaccine. The other thing here, a lot of country, they, like here in Tonga, we don't have virus. We don't have COVID. So in other countries, they still thinking. If we look here, the 29th of July 2021, which is just like last week, USA government or the FDA didn't approve the AstraZeneca. So why the rush here? Why we are rushing? Okay, and it's American. And even when you read this one, can you play? Can you get this one? The last, the last, the last link I put.
The last
The
link?
one. Yes, please. And
Okay.
read it. That's the FDA. They
Right, the one
still
with the FDA? Okay.
waiting for the approval from the FDA, and we are
Okay.
here. Right, give us the people opportunity. So share the this one. Yeah.
Yeah, I'm sharing the screen, but which one? Hold on. Not sure what happened with my screen. Okay, this one with the FDA?
Yeah.
Yeah.
Okay, do you want to
February,
play that?
2021.
Yeah, hold on, let me... This one, huh?
Yeah.
Okay.
You can see Brenda.
Yeah.
Yes.
Okay, you can read it now so people can see.
Okay. My screen is off.
Okay, hold on, Brenda.
All right.
Because...
This is interesting. It's scary already.
Hold on, Dr. Ray. Is this an article or is this a...
No, that's a new. That's the new. That's the
Okay.
AstraZeneca.
Sure.
Still hoping to get approval from the FDA, but so far the FDA didn't give approval to AstraZeneca.
For some reason, I put it on the screen. Okay, right there.
Okay, look.
I have it right there. Do you want me to play that?
Yeah.
Okay. I think that's the one. Oh.
People wear masks in public indoor settings.
Hold on. Is it?
In areas with substantial and high transmission, CDC recommends fully vaccinated people wear masks in public indoor settings to help prevent the spread of the Delta variant and protect others. This includes schools. CDC recommends that everyone in K-12 schools wear a mask indoors, including teachers, staff, students, and visitors, regardless of vaccination status.
We acted with the data that we had at the time. The data that we had at the time, the country most...
Dr. Ray, what did you say?
Not this one, stop. I tell you, after the show, I will put all the link. So people just can press the link and watch.
Okay. Was there
So,
something that you want us to read on the screen?
no, I'm just about the news about the FDA approval. And
Okay.
well, so far the FDA is not like didn't give approval to the AstraZeneca. So you can
Okay.
put us the three aspect now.
Ayaga AstraZeneca of the approve FDA American niya. Ayaga Food Drug Administration.
Yeah, because they knew before Mahana na osi have a pre-knowledge oku it's a preventative process. It's not a cure, you know. So they should say something, you know. The lady is saying it, but why didn't we know about it? That's the scariest part.
Yeah. And why did they rush the people to doing it, but without,
Yeah. And then now, my first side effect, Dr. Ray, was this muscle spasm in my back out of nowhere. You know, that's part of
some side effect. That how long you take the shot?
it. Just happened, and I was stretching out.
No, I tell you, because sometimes it take like 2 weeks for the side effect to be completely gone. That's why I'm asking you. But again,
how long ago you have the shot, Brenda?
The shots was done back in April.
So till now.
Until now.
Okay. I will send you some blood tests you need to do it, and when you get the results, send it to me.
Okay.
Okay. But again, you didn't take AstraZeneca. I think in America you take Pfizer, yeah?
I was sharing with Emeline. I thought I had a heart attack because this happened. I I was ready to call 911, Ray, from my bed, because I didn't feel anything other than the muscle. I didn't know it was a muscle. While I was laying in bed, I was going through my Google. Okay. What happened if I have serious pain on my lower neckline on the left side? Serious pain. I feel like I'm gonna die. That's how I. And then he
No, I
says,
tell you why. Can I explain to you why?
why?
Okay. Have you taken any cholesterol medication?
Cholesterol, yeah, that's part of my daily
Okay. Why I'm
medication.
asking you that? Why I'm asking you that? Because the component of Pfizer, it's cholesterol and lipid.
Oh
Okay.
my, yeah.
See what I'm saying now? Because for me, the component is very important.
For people to
As
see.
I said, we have component here. We have component here. Every type of vaccine, we have different components. When I talk about Pfizer, okay, Pfizer, you have around 3 different type of lipid, and I have the cholesterol. But the cholesterol in the Pfizer is lipid again, like it's type of lipid, but it's cholesterol, like that's in lipid. So the component of Pfizer different than AstraZeneca. Today I explain AstraZeneca because we have AstraZeneca here, but next time I will talk general about the other type of vaccine like Pfizer, what the
The
component
Pfizer.
in
Yeah.
Pfizer.
So,
Yeah. But that
Brenda.
will show you why you get this muscle spasm and why you feel like your heart will stop. Because the components of the lipid and the cholesterol,
Cholesterol.
In the
which
Pfizer.
is here, yeah, here, the doctor must go with you. We have something called the risk sheet, must be filled up from the doctor to the patient. So the doctor already know your history or not. He must ask you before you take the vaccine. Now, you are
Wow.
in America. Yes? Before you took the vaccine, did they ask you a lot of questions or they just give you the vaccine and that's it?
Brenda?
There was a form that you fill out.
But not your doctor. But not your doctor, Brenda, eh?
Not my.
Your doctor did not ask you the question for the vaccine?
No, it was not my personal doctor. It was the King County people.
So you just
But,
went in there.
but how come? Because now, when you fill the form by your hand, you are responsible for all the information you gave. Because
I
you know
gave the
yourself.
honest. I gave them my honest opinion.
But you never ask about the component?
Because these are
There
not
was
doctors. They were not doctors. Yeah.
Yeah, and remember,
That's sad.
Dr. Ray, remember, prior to taking the vaccination, you have all the questions in the world. Why are we taking the vaccination? But that's not to my personal doctor or my physician. No.
Mm-hmm.
My physician takes care of me every day so I can see you and talk to you now, right?
But did he recommend
What I
you to go take the
suggest,
vaccine, Brenda?
No, no. He just told me that I'm very healthy and my sugar is low and my cholesterol is no cholesterol.
But you're taking the medication for cholesterol, is that right?
Yeah.
Yeah. Let me, Dr. Ray, I want to really translate this thing, Brenda. Cái Pfizer, bé có thể cái component của Pfizer, hinga Benny, I'm going back to the same reason why vaccinate is not for everyone. Aya kung ginatol kon o kung take a cholesterol medication ni o kaya ay may a Pfizer ya a component of Pfizer ya o kung COVID kaya ay a cholesterol. Kung meron na tawang iba ko daw labi ko aninay, but I'm pretty sure Dr. Ray, we're gonna be next time we talk, we're gonna talk about the component of the Pfizer because this is the same message again and again. This is why vaccination is not for everyone because there are people who are taking medications and some of the components are already having what you're already taking. And I believe that's why it's not for everyone. But I think it's important to consult your doctor before you even take it. So,
Yeah, but remember, the doctors and the nurses already took the vaccination, but you don't see it physically that if they do or not. But the thing that concerns me, it is the fear, Dr. Ray.
there was push
There
people.
was a wave of fear on when this virus came. Why it took so long for us to get it cured. Why is it so long? And people that was dear to us died. And it's
okay,
not
I'll
like,
tell you.
yeah.
I
And it
Let me
just gives
explain to you.
you some emotional grip, fear that grips you
Okay.
all together. Yeah. And so it's a push to take it, but not.
Okay. For health practitioners respond to the public because we have now an emergency situation. Okay. For me, or for any health, even the World Health Organization share the, when you share the information you have to your patients or to the people, that will relieve the pressure from the public. The public make here, that's the miss, like the conflict, and make people angry from the doctor or from the World Health
Yeah.
Organization
Yeah.
because the information released it in a wrong way. The information comes this to prevent symptoms, to make when someone gets sick, don't have a dead symptoms, like the high risk of death will be come. That's the purpose. Okay.
Okay.
So, but here the people stuck in their mind the memory. Can you hear me?
Yes, we
Yeah.
can hear you.
You're good.
Okay. So what happened? Sorry. So what happened here? When you take the vaccine, you already knows, oh, I'm safe. I will not get sick. That's because wrong information. The information here, we prevent symptoms.
Right.
We prevent symptoms. And that's why at the beginning I try to explain the three different level of vaccination. Vaccine deal with the virus straight away by give you dead virus or weak virus. Some just with the S spike protein. Some deal with the messenger. Okay. With the vaccine we have so far, we deal with the material
like the messenger, okay, or with some of the protein. We get like some similar protein from some virus to us, okay? So everything here, it has to be biologic. When the people understand now, it's your choice.
Yes.
Okay. And you still know you take the vaccine, but you still need to protect yourself by wearing mask, washing hand, wear gloves, keep distance. But people, that's make it worse. When they took the vaccine, they can do whatever they want. No, 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 no. It
No,
doesn't work
no,
like
yeah.
this. Because so far, some study, we don't have studied 100%. There's a lot of things start, and you know, we're running now because we have Delta, a new
Delta
type.
variant, yeah.
Okay, so again, the people must understand that the purpose of the vaccine to prevent the symptoms, not to protect you 100%. It's nothing like this.
Mm.
Okay.
Okay, let me translate that part, Dr. Ray. Ke tau mua ko vaccine ko nok lau he Dr. Ray. Kono inga ke prevent, but not ka ikai kene hanga o malu I ko pesete teau. Okay? Aya ko foi me ko ke tau mai noi. Ai uhinga vaccine kene hanga pe mal o prevent. Tau tolu me hinga hi symptom ko o COVID ka ikai kene hanga o malu I ko pesete teau. So I think if we get that, that will be a good thing for us at our learning body, eh? Brenda? Yeah.
I
Back to you,
wanna
Dr. Yeah, go ahead, Brenda.
I wanna share with you. You know, when I went to get my new phone, right? I was telling you I was there, and
Yeah.
so the customer service, all of three of them didn't wear their mask, and I was going in with my mask on, right? And I said, why are you guys requiring us to wear masks and you guys are not wearing them? You know? And the lady looked at me, because we're all vaccinated. And I turned around and I said, who cares if you're vaccinated? I was vaccinated. I can't guarantee, that when I walk out of here, I'll be better, just by seeing you not wearing the mask, but you're mandated on the door. You can't come in until you have a mask on. What kind of message are you, I end up fighting with them instead of getting my phone, and I left, because it makes sense what Dr. Ray was saying, and I left the next day knowing that I have to be more careful to myself, but it makes me upset that we are categorized
as a herd immunity.
Immunity.
Yes,
To
that's
me,
sad.
we're categorized with the herd of cows or herd of bulls and and all these buffaloes. You can never say herd of people. It's scary. I'm
Look, I tell you, this type of conflict make the people get upset or they feel that we are not secure. Okay.
Yes. Yes.
But when it's clear, that's make the people understand and calm down. Okay.
Right.
The end of
Right.
the day, everyone do his best. Okay.
Yes.
The vaccine, if someone have a chance when he get the virus, if like 50% he will die, 50% he will still alive. So if he get the vaccine, if he have like 10% chance, maybe he will die. So the risk is different. When people measure the risk between person to person, is different. Someone will say, I'm saving myself, I will keep distance, I will do 1, 2, 3. Okay. Some people they said, it's 50-50. No, I want to keep my life, so I will take it, and if I have a stroke, if I have anything, it's okay. Better than nothing. So the risk here, majority is different. But again, the people must understand the purpose to prevent symptoms, not
Yes.
to be deadly, to come less.
Mm-hmm.
Okay. And so when you protect yourself by wearing mask and you have the vaccine, different story, then you protect yourself. But again, you know, wave one, people sick and people didn't get sick. We don't know why. People they die and people they didn't die. Okay, there is a lot of things here, but for the time there's a lot of things happen every day, and even like countries they have the vaccine, they look down again. Okay, because the people they forgot they must wear mask and gloves till we get the 100% protection. But so far we're dealing with preventing. So dealing with preventing, that's mean I still need to wear all this stuff. In the meantime, the understanding. Look, we have religion side. Okay, I'm not talking about religion because I'm not a priest in the church or pastor or whatever. Okay, I'm here talking about medical reference. What we have so far, what the study showing. Like I tell you, when pregnant, you know the pregnant not allowed to take vaccine, especially AstraZeneca, because AstraZeneca because it's come from the messenger from the chimpanzee. When someone have the phospholipid syndrome, especially in women, that will cause miscarriage straight away. And I have this case here in Tonga. The lady been married 7 years, no kids, and by her luck, she was pregnant first time since she get married. She's pregnant, took the vaccine, second day miscarriage.
Oh.
Look at the sadness here. And that will be the first child for her after 7-year marriage.
My goodness.
So again, the important, we prevent the asking questions. If the woman not sure she's pregnant or not, get $10 and do the test for you. If pregnant, stop. If someone can't, if you are not sure, do it. Tell your doctor, I'm not sure. Do the blood test, get everything is ready. And then it's your choice, not by the law.
Yeah, not
the
by
end
the
of the
law.
day, when you take it, you must know it's for prevent.
Ai ka mea mahu I ngā ia, ka mea mahu I ngā I tam kau ke hangai o ai ka pau ke whie
Talatala,
ka pau ke whie huhu Ai ka koe mea ni tahana I winga mai toki tā ke karai kau whai tama o koe ki sai ka moto vaccine Ai whi mau ke sio mai kau toki tā ki mua ke you know,
The end of the day, yeah, I want you to translate this one. The end of the day, I'm not against any type of vaccine. Okay, I'm with the type afford to someone like this type of vaccine. It's good for this one. I'm not this type to agree one type for all. It doesn't work. Vaccine, it's for prevent, but what it's good for you,
it's
it shouldn't be like a general to be good for all.
It's no one size fits all, Dr. Ray. No one size fits all. Yeah.
And the end of the day, it's your life.
Yes. Brenda,
okay. And it's make me wonder when people take the vaccine. Okay, that's if you get sick, the symptoms will be less. So what cause you if the other one take the vaccine or not? Why you scared? You already know if you get the virus, the symptoms will be less. You should sit and laugh on the people they don't take the vaccine. You get the idea?
Yes, you get the idea.
What this for? If you take the vaccine and you feel you protect 100%, which is not, don't be aware for other people. But here the problem that prevent. The vaccine to prevent. That's all the facts so far. But the World Health Organization, a lot of they still working to get the one protect 100%.
Okay.
But for the time being, protection, that's the very important, how to protect yourself. Okay.
Okay.
So I'm thinking now, people will have idea how they will respond to the law.
Yes.
Again, I'm not pushing anyone to say anything. Everyone has right to accept or to refuse. Everyone have right to take it or not. The end of the day, we do this show to explain to the people facts, what the component of the vaccine, what this vaccine for, why this vaccine is suspended, why still, why. We answer all the question in a very fair way.
Yes. Mm-hmm.
Because
And
it's
where
not
the
it's not
people
good when you
and
push the public in one side.
yes, I believe that too. Okay, Dr. Ray. So when these people need to respond, is there a place where they need to go to respond for this law, or how are they going to submit their writing? Do you know of?
Well, what I hear so far, they give the writing in the parliament.
Okay, so they have to just show up at the Parliament House and submit their writing.
Yeah, in
Okay,
writing.
right, in writing. Ke Megani o lawe mai ka kia to kita Brenda na makamata mai o ngai lao o fa o Tonga na fe ma
Ia.
na mandate ka ku tala mai ke publici ke na lava pe o tohi mai ki he e na uhinga ko pe te na io ki he lao ko ni pe ikai ka ku fe ma ke na alu ki he whare area o whai e na tohi ke pe ko tu mau inga ke tonga ko tope o ki tonga o ku ke whanonga ki he programa e whawhini, o ange ko lau kai tohe tā, o kai kene against the vaccine, ka whema o ke tau mahi no i a ngai component, pe ka ngahi ingredient ko o ngahi ake vaccine ko ni, he ko vaccine ko ni o kai ko ha one size fits all, Ai o ku ke he pe ai sino e tā ko tō pe ho react ki he vaccine ko ni, pe mahu inga ke tau hanga wa ko i mo tonu, pe ka pana ke toki huto mui me ke programa e whawhini, te kama te hanga pe rerun at te programa ke nga he ku show ka kato mai a PowerPoint e whawhini e mau hanga koe o atu koe koe ai mea ko ni ka koe mea ko o whema koe ke whamama whai mahe toke tā he whawhini koe vaccine koe ni o i kai ko ha 100% ke ne hanga malu i koe ka o koe preventive pe ki ho o
Like,
ke nga hi
I want to
symptoms
add
e
something.
Go ahead, Dr. Ray.
Okay, like we have here Mormon, yeah, and the Mormon they don't drink alcohol.
Yes.
Be fair and tell them this vaccine they have alcohol, because that's respect of religions and the culture. You
Right.
got it?
Yes.
Yeah,
Yes.
translated.
Yeah, oku ne whatata mai ki he kau mamonga, o pepe me kau awhitu, o ko prenta mamong ko awhit, o kai ke mo winu kawa malo. Ka ne pehe ko vaccine ko ni, o ki ai alcohol ai.
Lots
So,
of alcohol.
o ko vi au pito ya ka ko I ko uhinga ia, I he uhinga whakalotu, o kai ke sai a vaccine ko ni. Ai au te whaki mai penge fo uhinga ko na lau he WHO, but vaccine koni is not for everyone, Aya o kai ko me ni ke fit all. Ka hangai ko la ko ai to da. Ko lahi ko ho ilo ke famatala ko nga ingredient ko ni. La vale ke fai le
Make a decision.
yes.
Yeah.
Make a good choice. And at the end of the day, ka osi ko ai ngata ko ai aho ko it's about ko mo wien ai ka fa ka ni te ke fai e ko ai fa ka le le ka mau inga ke ako ke ilo ai nga hi mea o na hanga fa o I vaccine ko ni anything else Brenda I want to add to that
Ko ai pe ke share ka ko mo Dr. Ray Emeline.
Go
Ko
ahead.
ko siasi hen he fonwan.
Go ahead.
O na attention mabahe ki he fo I ta o ko ni ono no ano ni ma ki olunga.
Go ahead.
So pana o mai na proclamation ki e kainga lotu. Ke na o huhu. And it's on the expense of the church.
Can I get another ingredients?
No.
Maybe it's time for us to educate them on what's in the ingredients of this vaccine, you know.
Pako mi lebe ko rau ko mau o atu hange heard
Right.
of unknown. Hange ini ko o atu pe ko ke
Whakasipi ka te slaughter, eh?
slaughter. Yeah.
Yes.
Kako mi asai pe o hange ka lau array o pi pe ko prevention in.
Yes.
Aya ka to ya na to mi a Pfizer ya ke to yo mai ke mandate hafahinga me. Heck no. I'm gonna.
I think it's important que te talano que te toqueta, you know.
Yeah.
I mean,
There
because
is
your
one
doctor
more
is
thing
the
here for Brenda.
Yeah.
If you still feel the muscle spasm somewhere in your body, because heart, it's muscles.
Yeah.
Okay. So that's thing from April till now, just like 4 months. It's very important to go and visit your family doctor, and you need to do the lipid test in your, it's come from the blood test, testing the lipids. And also it would be good to do the CBC or the full blood count. So if anything, we must be aware, because muscle spasm, heart is muscles. Like some people, they get cramps, and that's maybe a very beginning of heart problem. So if you still now for 4 months you feel this some types of muscles spasm, don't wait. Okay.
I never had it before. I just had it.
Yeah, but we need to do further
know.
investigation for this, because heart, it's muscles. It's a muscle system.
Yes.
Okay.
Interesting.
So when you get a spasm in the muscles, that's we need to check. We need to be aware it's away from the heart.
Yeah.
Okay.
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 All right. Anything else you want to ask? Or we finish for today?
So
no, there's nothing else to ask, Dr. Ray. I think we're just looking forward to talk about the Pfizer component next time. Maybe we'll do that on Tuesday.
On Tuesday, yeah.
Yes, let's do that on Tuesday, and then we're off on.
Yeah, but you know, Pfizer, the component of Pfizer, they don't have alcohol.
Okay.
See?
Okay.
That's why Pfizer need to be diluted first.
Okay.
Yeah. Yeah.
Okay.
Thank,
All right.
thank you, Dr.
Malo.
Ray, so much. Malo, Ofito. Ofat kasisi mo ko eh. Ofat.
Bye.
Malo.
Malo.
Yeah.
Thank you, Ray.
Okay, Brenda, ko lava ito programa. Dahame give a final word. Kaya tama ito fast pause. Ito.
Ko mahalo ko tau lava, pag end of the day, ko ilo ko ni mea koko.
Kaya.
O ko fupuputu au pito. You know, like everything is just scrambling differently in my head.
You know, Brenda, let me say one thing about myself. Me, I'm the kind that I took care of myself very, you know, let's say very closely.
Biblically.
Yeah. At the same time, I never rush to anything that gonna harm me, because I have to do a study. I have to research more, and the more I listen to a lot of doctors, and I knew this vaccine is not gonna be for me. So that's why I have been standing on my ground on that one, and I'm glad that Dr. Ray come in. Dr. Ray. At the end of the day, this is your life. This is not about the public. This is not about the politician. This is not anybody else, but it's your life, and you're gonna have to protect your life by an arm and a leg and everything else. You know
And
what I'm
all
saying?
you have.
Yes, that's all you have, and we only live this life once. You know. So, but that's what we're gonna maofalahia kamuto pe malo ko tau programa he pefini ko kolet ke mo to hanga replay in kapana ke mo mai ko laki ai hanga to ta o outline mai anga component of he vaccine, and then you make the choice after you educate yourself, eh? Ta ko yape ko ofat kamotol, and have a good night.
Yeah.
Tautawa lepe a motaka
Malo, Momea, good night.